You know, and I think it's interesting when we talk about things like, when do we say enough is enough with the filler, and you know, when is it time for more of a surgical intervention? We were just talking about the chin, right? Sometimes people metabolize the filler a little bit quick. Sometimes you can't really get to your aesthetic goal with just filler alone. When do you feel like you say, you know what, like this patient is just truly a surgical patient for, you know, maybe they have a severe recessed chin, or they have other concerns that we can't really do with filler?
Yeah, one thing I think, you know, the timeline. So I think fillers are great options when you're like in the 20s, 30s, even early 40s. And then it becomes to a timeline where, you know, aging is a little faster, there's a little bit more changes, and fillers can do only that much. So you cannot achieve with filler what the patient would like. Or if you try to achieve it, then there's a point where it looks overdone.
Yes.
You know, then you have like, oh, this patient has now a pillow face because there was too many fillers added to the facial structure.
You almost get tunnel vision. It's just like you're just focused in that one area and filling it and filling it, and then you just forget about what's supposed to look natural.
Yeah, that's really true, and we see it on a daily basis. So then that patient becomes maybe more of a surgical candidate. Let's go back to the chin. You can put a couple of cc's of fillers in there, and the projection looks a little better, the jawline looks a little bit sharper, but there's also a limitation to it. You know, there's one point where you think, you know, an implant would look just a little bit better, and you don't have to go for the repeated.
Continue.